Now coming to the complications. As with any surgery, there are always associated complications as well. Now, knee arthroscopy has a lot of advantages. For example, the advantages first and foremost is the very small incisions being utilized. And this next less advantage is that you can do everything inside without actually opening up the joint. Therefore, the chances of infection is quite less. Then with every advantages, there are always, with every pros, there are always some cons as well. And the most common complications include is the iatrogenic articular cartilage, because as you're putting in trocars, there is always a chance that because sometimes there is not a lot of space available, and sometimes a novice surgeon may be struggling with the trocar. So when you are actually fighting in for the space, there is always a chance that your trocar hits somewhere over the cartilage of the femur or over the tibia as well, and this would eventually lead to problems such as articular cartilage damage. Now, articular cartilage damage may not be initially apparent, but when it accelerates arthritis so much that it actually results in leading to this problem, then this may eventually predispose the patient to early osteoarthritis as well. Therefore, as it has advantages, the disadvantages that it can be is having a articular cartilage damage. Then hemarthrosis. As you know, although the tourniquet is actually utilized to reduce the blood flow through the joint, but once the surgery is done, we have to open up the tourniquet, and then maybe microvessels which may have damaged during the surgery would continue to bleed, leading to hemarthrosis. And the patient may require some form of aspiration of blood from the joint as well, because sometimes the hemarthrosis may be massive enough that it can be leading to a compartment syndrome as well. Therefore, this is one of the very important complications of hemarthrosis of the arthroscopy of the knee joint. Then neurovascular injury. As you know, the popliteal artery and the main sciatic nerve dividing into peroneal and tibial nerve as well as the popliteal fossa. Therefore, especially with the surgery of the PCL reconstruction, there is always a chance of a damage to the neurovascular structure. So you have to be absolute skillful in avoiding that. That is why this surgery has a very long learning curve, which may lead to, once you usually said that you have to have at least seen 100, then assisted 100, and before you go for your first independent arthroscopy. So once you've done that much of surgery, then it's easy, but before that it's a very long learning curve, and that is because it involves a lot of intricate movements, and you have to be extra fine with the hand to do these sort of things. But as with the advantages nowadays, it has become because there are a lot of advantages with arthroscopy, it has become a very common procedure and everyday procedure. And nowadays arthroscopic surgery is very routinely performed, and there are specific knee surgeons who only perform the knee surgeries and arthroscopies and arthroplasties of the knee joint only. And they are mainly trained, and because they are only doing the knee joint, so they are doing knee arthroscopy day in day out. So they have actually resulted in a lot of decrease in the complications as compared to, let's say, 5 or 10 years ago. But still, these are some of the complications which may occur with the arthroscopy. But usually nowadays, because people have perfected the art of arthroscopy, the complications have reduced a lot as compared to, let's say, 20 years ago.